Hi, this is Dr. Eric Westman with another edition of Ask Adapt. This show is dealing with macros, how you calculate them, should you calculate them, and also total and net carbs. Debbie writes in, our paleo ancestors didn't know a thing about macros, much less calculate their lean body mass to determine how much protein or fat they should eat, and then recalculate and adjust as they lost weight. So why should we, or even do we need to, calculate and track macros? Well, Debbie, I'm in total agreement with you. One of my philosophies is to keep things simple. And so in the program that we developed and use with good success, you don't calculate the macros at all. Of course, the way that most people use this approach when they come to me is to lose weight. So I should say, when you're trying to lose weight, you don't have to calculate the macros. If you stick to the carbohydrate restriction, at first a 20 total gram per day restriction, and then you eat real foods like eggs and seafood and fish and poultry and meat, you will get the fats with your proteins, and you'll pretty much automatically have less hunger and lose weight. So one of my philosophies to keep things simple is to not have people calculate macros. Now, if you're trying to do a therapeutic ketone level for a certain disease or certain performing level, then that's a different issue. Then you might want to calculate the macros. But for most people who are losing weight, there's really no need to. So Liz wrote in, where do you recommend a person to get their macro calculator, or what resource? And as I mentioned, I don't ask my patients to do that at all. Julie wrote in, what are your thoughts about counting macros as opposed to counting grams? Again, it's a matter of simplicity and that it works. If you just count total carb grams, not net carbs, total carb grams, then you don't have to calculate the macros. What about if you're low on the carbs, but your cholesterol goes up, or you have high cholesterol? Should you only eat certain fats? Now that's a carryover from the old world of being afraid of saturated fats, because saturated fats can alter the blood cholesterol pattern, I think even under a low carb diet. But we don't worry about that because the metabolism going on inside, the fat burning metabolism, handles the fats entirely differently. So I'm not afraid of having people eat fats, even saturated fats, as long as it's a natural fat. I don't worry about it. Now, some people, Liz writes in, some people load up on fiber so that they can have more carb grams, but that caused gas and bloating and heartburn for her, and feels better by not doing that. Right, so if you include the fiber in the total carb calculation, you won't get the gas and bloating from the fiber. And then you also won't be eating these bars and other foods that are higher in total carbs. Don't look at the front of the label that says net carbs. Make sure you go and look at the total carbs in any product that you consider eating. Why is it important to use total and not net? Well, there's an assumption if you use net carbs, if you subtract out the fiber, that there's an assumption that you don't absorb the fiber, and that doesn't occur for everyone. So some people do absorb the fiber, and it does impact the ketones and the blood glucose. So worst case scenario, you'll want to assume that you do absorb some of the fiber, so that is protected by just using the total carbs, total grams, not the net grams. Another way to look at it is, it's not that net gram calculation is wrong, it's just not as strong. So it's kind of like an over-the-counter medication. It's not wrong that there's a 200 milligrams of ibuprofen out there. It's just that if you have a bad metabolism or you have diabetes, if you have a carbohydrate intolerant metabolism, you'll want the stronger method, which is the total gram calculation, not the net grams. Christine writes in, what about the fat to protein ratio? And looking at, I assume that's what some people advise for the macro calculator and to change the ketone levels. I don't ask people to modulate their fat protein ratio at all, and it seems to work for most people. So, until we have research that compares the simple system of just 20 total carbs per day without regard to the macro calculations to a study where they do, or people do calculate those sorts of things, I'm sticking with the time-honored simple system of the 20 total carbs without calculating macros for my programs that I run. Hope that's helpful. Again, this is Dr. Eric Westman with Ask Adapt.